Welcome. My name is Melissa Lowry Hallen. I'm a physical therapist for Memorial Rehabilitation Institute. I've been working for the hospital system for over 25 years, and before that I worked at Johns Hopkins Hospital in Baltimore, Maryland. And I'm excited today to talk about the importance of physical therapy rehabilitation and discuss different things that you can do at home while sitting at the computer and sort of preventative medicine. So the principal objectives today, like I said, is to discuss the importance of physical therapy rehabilitation, the types of physical therapy intervention that's offered at Memorial Outpatient Healthcare System, review ergonomics in the workstation, and discuss proper posture versus faulty posture, then go over some exercises that you can do. Now, what I want to do is just have you think a little bit about questions to ask yourself during this lecture. How are you sitting right now? Can you sustain the way that you're sitting during this lecture? Do you have any aches or pains sitting right now? And how long a time do you sit without getting up from the chair? Even today, when I came in to set up for this lecture, it's in a closed room, a different place. I had to get all these things to set myself up because when I first sat down, I thought to myself, there's no way I'm going to be able to give this lecture unless I get myself supported in the right posture. Now, before I went to research to look at what I'm doing for the lecture today, I looked at Sapoznik company and I found out a lot of really interesting facts. It's recognized as the 2019 healthiest employer in small company category. It's actually the 5th largest insurance agency in South Florida, the 14th largest women-owned business in South Florida, the 22nd most charitable corporate giving group. The other thing that was really interesting is that their offices, I researched, were newly renovating some on-site gyms, relaxation area. It looks like a place I want to work at, like an Apple. And I see that they're really trying to shift the paradigm from sick care to well care. That's why I guess I'm here today to try to talk about more preventative medicine and how to help you. Now, typically I'll say that when you think about physical therapy, most people, if you look down here at the picture and the slide here, you think about somebody walking with a walker. Usually in movies, you'll see a physical therapist working with a stroke patient or maybe a spinal cord patient. So it is true that we really do help people with gait or walking mobility. We want to prevent falls on an inpatient level and even an outpatient, improve mobility, but it's much more than that. We're working on range of motion. Maybe you have a frozen shoulder and you can't move that. We work on the range with that, a total knee replacement, but we're also there to try to gain strength and gain stability to help with the spine and posture to be able to return to work. Also trying to get athletes back to peak performance, but really to try to reduce and eliminate pain, and also hopefully maybe even avoid a surgery. Physical therapy over the years has changed dramatically. Since I've been a therapist, there's been so many changes. There's tons of specialties out there now, specific work hardening training to return to work, vestibular rehab for inner ear balance problems. There's also women's health, pelvic floor dysfunctions, and even aquatic therapy. Now at Memorial Healthcare System, outpatient services, there's 5 hospitals for inpatient and outpatient. A number of our therapists have advanced certifications in really specific niche treatment. So there's tons of things that we offer. We have the amputee, limb loss rehabilitation. Of course, we have back education, prevention. We have aquatic therapy in 2 facilities. We have pools that we work with patients who can't do land therapy, even actually pediatric patients with developmental delays. And also for cancer rehab, We have certified lymphedema therapists where you have swelling in the arm because the lymph nodes are removed and they work with controlling that. As I said before, vestibular for inner ear balance issues, also pelvic floor health for incontinence for women who are having difficult or painful urination. In sports rehabilitation, we have something that's more new in the past couple of years, certified blood flow restriction training, where you're unable to strengthen the normal way, we end up restricting blood flow to strengthen faster with less repetitions. And of course, a number of other certified orthopedic therapists, special Parkinson's programs, even osteoporosis, where women have, or men too, have brittle bones and they have a loss of that bone density. Now, what I wanted to do is talk about really why I'm here, the ergonomics in the workplace. When you talk about ergonomics, it's the study of people's efficiency in their workplace. Usually, to be a board certified professional in ergonomics, you have to have already an advanced degree in engineering, in human factor, and physical therapy. So really, you're trying to fit the workstation to that employee. I like to say it's trying to find those perfect pair of jeans. Everybody's different, every size and shape, and you want to have a custom pair of jeans. So that's how it's sort of fitting the station to you. If you look at this picture right here, you're looking down, from up going down. Now, when you're fitting an employee to the workstation, it's very precise. If you sit back in your chair and you reach all the way forward with your hand, that would be actually your arm reach length. Now that, when you're at your fingertips, you're sitting close, all those items at that range should be something that you're not really using that much. Those items, you want to not be reaching so far forward all the time. Then you bring your hand back, that's mid-reach. Now, if I bring my hands close right to the edge, that would be near reach. Near reach really is where I should have my keyboard. So if I look at this picture here, it looks like this guy has full arm reach. So the keyboard should really be back right here. So for instance, my keyboard, my cup of water, I'm thirsty all the time. I take a sip, I want it right there. I don't want to have to be reaching far all the time, over and over again. Now, also you have to look at the computer screen. And in all actuality, a monitor where you have the monitor up here versus a laptop is a whole lot better, because depending on your vision, depending on your height, how tall your torso is, the computer position of the monitor might be 16 to 18 or 16 to 28 inches back. The tilt of the screen, depending on your vision, you want it about eye level, that could be 0 to 20 inches at a tilt. So those are really things to take in consideration. Now, when you go ahead and you look to the side, your elbow angle should be about 90 to 100 degrees, a straight, square angle. Same thing with your knee, about 90 degrees. You absolutely want to have your feet supported or on a footrest, and your hip could be anywhere from a 90 to 120. Now, the next picture here, this is a patient I've been treating. Actually, I saw her this morning at 7 a.m., so I've been up for quite a while. Now, here you can see that I have her sitting straight. I had her do the arm reach. So right here at this tip, that's where she doesn't want to have a lot of things she has to reach for day in and day out. And you see how the keyboard is close here, and I have her supported, because most chairs, unless you buy a $1,000 special ergonomic chair, you have to make adjustments for that chair. And here in this picture on the left side, I would probably move her maybe just a little bit closer to the table, but you can see from the feet going up, I had to give her a foot support. I don't want her causing pressure, decreasing vascularization behind the knee here. I also gave her a wedge support, so her back was perfectly angled in the chair. So not only was her low back supported, but I had to give her another sort of wedge up here so she was straight. So she wasn't leaning back, so she wasn't too far forward, so she could sit comfortably. And I have the keyboard back here so she can reach, and her, you can see her eye gaze looking straight ahead. Now, discussing posture, proper posture versus faulty posture, you may have heard about text neck posture. It's sort of a common term. Maybe you have, maybe you haven't. And if you look on the screen right here, you can see her neck's pretty straight. She's upright, holding her phone here. As you go from the left all the way to the far right, right here, I don't know about you, but my teenager and most kids I see now using Snapchat and all those social media stuff, they're bent forward like this. So you really want to look at how your posture is when you do everything, not just at the computer, but on your phone. And to make the point more succinct for you to see what I'm talking about here, this next slide, I have the actual numbers. So if I look to the left right here, here's someone holding their head up straight, like you saw the girl at the picture looking at her phone. Now, a normal head weighs about 10 to 12 pounds. So that's when you're upright here, the weight of pressure on your cervical vertebrae, the weight of pressure distribute through your disc and your muscles, it's all evenly distributed. Your body can sustain that. But now, as you just go maybe 15 degrees forward, or even 30 degrees forward, or like you saw on the far left, really bending down. And this could be looking at the computer or a laptop too. When you're in this posture here at this extreme range with the 60 degrees and even 45 degrees, think about the strain of your muscles, trying to hold up the head. So if you're looking just at pure physics, right here, your fulcrum of the seesaw right at your neck at that lower vertebrae, C7, and then you go into your thoracic, T1. The pound of pressure is 49 pounds. That's a tremendous amount of weight. Our bodies aren't made to hold that kind of pressure. So you can see just with this kind of posture, how much that affects your back, how it's straining your necks, trying to hold up your head. It's tremendous. Now, just to sort of give you a review about normal posture versus some abnormal postures, or even congenital. So congenital may be something you're born with, or a change that might occur versus just a functional or faulty posture. If I look at the left-hand side, a normal posture, you have a little bit of curve going in, you have a little bit of curve going out, and a little bit of curve in at the neck. So it curves in at the neck, at the cervical, curves out at the thoracic, at the upper back, and curves in at the lumbar, at the lower back. When you have a lordotic posture, you curve in a little bit more at the low back. Now, you'll definitely see this when you're pregnant. You're going to have lordosis when you have that baby in the front. That's normal. But sometimes you'll see this increased curvature just when you have weak abdominals. So working on strengthening the abdominals to decrease the curvature so it's not so excessive is going to help. When I come over here to the next slide, the kyphotic posture, you have an increase over curvature here at the upper back or thoracic spine. This typically you'll see with somebody who might have osteoporosis, where you have brittle bones and you have decreased bone density. So the vertebrae start collapsing. So medically, you'll see this kind of posture and that kind of diagnosis. But in maybe that text neck posture that I showed you where you're leaning forward, you might get this kind of posture because you're just weaker on those muscles on the back and you're really tight on the muscles in the pectoral in the front. Now here, the flat back posture, sometimes you'll see this if somebody had to have surgery, a laminectomy, or they had to have rods put in their spine. They're flat back because of the particular surgery or laminectomy, or they could be really muscle guarding. You have pain here, and then you're guarding with your muscles, trying to hold yourself upright because it hurts, or you could have so much tightness in the front that you try to lean back. So this kind of posture, trying to decrease the pain or spasm to get those normal curves to come back. Now, scoliosis, usually you're born with, is congenital dysfunction. When you look straight from the back, it should be straight going down from this view. If you see a C curve, sometimes it's an S curve like a snake, you have an abnormal curvature. If it's excessive, you might have to have Harrington rods put in. Usually you need to have a curvature that's 45 degrees or more because it's collapsing on the lungs and you have to get that stabilized. And that's usually more of a congenital, something that you're born with. Now, to look at computer sitting posture, that's why we're here. I have these pictures here because I thought they look cute. I like it. This is a lot of times what I'll see. You're at home, you're leaning forward, you have the laptop, you're really looking down. That's almost sort of like that kyphotic posture I was talking about. So you're going to have an overstrain in the muscles, a lot of pressure, a lot of tightness in the front of the chest. You're not supported. Even when I come over here to look at correct posture for computer sitting, like I said, I thought the pictures were cute, but you really should be sitting back. Let the chair help you. You want the chair to help you. You want to be able to sit back and to be able to have the support in the small of your back, but also have the support in the upper back. Even when I came in here to set up, I have the chair with my back support here. And even though I'm in physical therapy, the chairs aren't that great either. I had to give this little cushion wedge. You see that? Almost similar to what I had my patient. And I had to put it in the small of the back of the chair I'm sitting so I can sit back and have something. Otherwise, I'm holding my body up in space and I don't have something to help support to make me straight. Another thing I had to do, and how there's correct posture here, is I come up as close as I can to the desk. So I'm not doing that far reach or near reach. So I can really reach the keyboard on the computer. And here, the best way to go, believe it or not, is to have a monitor. If you have a monitor, you can adjust it, bring it up so you're having that straight eye level. Laptops are really difficult. And ergonomically, the best things I've seen for laptop use is where they actually put the laptop on a stand and then they say, okay, purchase an electronic keyboard and electronic mouse, which sort of totally defeats the purpose of a laptop, but it makes the laptop almost like a monitor top, which is really the way it should be, to have your neck up so you're not tilted down looking at a laptop. And then another thing I just want to point out is having your feet supported. So you're supported with your feet, they're not dangling at all. That's really how you're going to support yourself. So this big talk about posture is for a lot of reasons. Because number one, like I said, and I was trying to prove, even when you're upright and you're sitting back and straight, you're going to be able to breathe better. Think about this slide here, how you're crushed forward, you're not going to get really good lung expansion. So if you don't feel like you have good respiration, and with a mask on, it's hard to breathe now anyway, right? With everything going on. So better to sit up straight and feel like you can breathe, you have the good circulation. Same thing when I was talking about the text neck. When you're so bent forward here, it causes tremendous pressure. Those muscles are overworking all the time. So just by being straight back, not having to reach forward, your muscles are in the proper posture, you're not going to be overstraining them, and in your low back and in your neck area. You're going to decrease that compression on the vertebral bodies in your disc by having that upright posture where all the weight's distributed equally. And just by the monitor, you're going to reduce that eye strain, the headaches, and you look taller. You look better because, oh, it looks like you got an inch taller. Now, as far as posture correction, ergonomics, the market is flooded. Did you guys, it looks like can you still see my screen? There we go. Sorry about technical glitch there. For posture correction and ergonomics, it's a huge market. Relax the Back has tons of $1,000, $800 chairs to get custom fitted. Some of the things that are external solutions, and they're popular and they do work, is what's called the upright go-to. It's a little tiny adhesive device that you put between your shoulder blades in the back here. And when you start doing that little bit of slouching, it vibrates. So it sort of gives you a reminder, oh, let me sit back. It has a phone app. It's called Posture Trainer, one of the more popular things. There's also something called an eye enforcer. But let's say you wear glasses already. Do you really want to wear glasses again? And what it does when you start coming forward, there's a little LED light that flashes. Another phone app to have. And then, of course, there's braces, like a posture corrector. But in Florida's hot, wearing a brace, something else on top of you. And it's not that these external devices aren't good and great ideas, but do you really want to have another phone app? Do you really want to have something else on your body or adhesive stuff? For me, I really want to sort of gear towards really trying to use your muscles, trying to work on self-correction. So internal solutions would be, maybe I had a little family picture up on my monitor, and when I see it, I think, oh, let me do a little bit of exercise, or, you know, some kind of color cue. Maybe my favorite color is red, and every time I see red, oh, I'm going to think about sitting up, pulling in my abdominal muscles, something like that. So I really go towards using internal solutions versus some of the external ones that are out there to try to use muscle strengthening and activation of our muscles to stabilize our spine, or muscle flexibility, trying to get length in that muscle so that muscle is not so tight. So I like to call them stabilization or lengthening exercises. So lengthening, getting the range of motion in that muscle so I'm able to not feel so stiff. And stabilization, trying to activate that muscle to get myself in a better posture. Because if I'm stronger in my upper back, I'm going to be able to sit back and it's going to be easy for me versus being so tight in the front part of my chest here. So what I did is I created a series of 4 exercises to have more of a stretching or lengthening, and about 4 exercises to get more of a stabilization or muscle activation to work on posture. So the first one here, I just called neck rotation with chin nod. So of course you're going to have tightness in the neck, tightness in the back of the neck. So with this exercise, and let me just pull up the video here. What I'm having you do is you're just going to rotate slightly, about maybe 45 degrees. Just pain-free range of motion, nod down for a little stretch, come back to neutral, 45 degrees, nod down, come back. This is not what you want to do. You see where I'm trying to go all the way? When you go all the way, then you're almost doing a side bending rotation, and you might go into painful range with your neck if you do have neck problems. So really what you want to try to achieve is just a pain-free short rotation with a little nod, and a pain-free short rotation to get the right range of motion. And all of the exercises shouldn't cause you pain. If they do, don't do them, or go through a shorter range. So this is what you don't want to do. Doing that rotation where you're getting a side bend, that's not going to be helpful. Now, the next one I just called elbow wings, just to make it fun. A lot of times, remember how I was saying with that kyphotic posture, you'll get really tight in the pectoral muscles up here, and the muscles in the back of the upper back don't get a lot of strengthening or stability. And you can even see I gave myself a cushion because this chair leaned back too much. And for me to be upright, you need to lean back on that cushion to give you support and also to be upright. So for this exercise here, what I did was I'm not grabbing my head forward. What I'm doing is I just gently press my arms up, and I'm just coming back for a nice stretch and coming forward. Coming back for a nice stretch and forward. And you see my back supported. And like I said, I don't want to grasp and pull my head forward. My hands are just gently resting on my head. So again, just gently on my head, not pulling it forward, just coming apart and coming together. Now the next one, I really do like this one, because a lot of times I feel as if you feel like you get tightness, you're in this posture, all these muscles, all the paraspinals really seem to get tight and you get tired. So I ended up clasping my hands together, and I'm just doing active range of motion, a simple range of motion where I come up, and you can see I'm not going really far up. My arms just come up. It doesn't even go behind my ears. I can still see my elbows. I almost feel like this was, if you remember that old Charlie's Angels where they have the pistol and the gun coming up, I thought that was sort of funny. That's what it reminds me of. So just coming up and reaching, not really high, just within a pain-free range. That's it. Looks good, Norman. So just again, just coming up, and you're just from your chest up, and you get a stretch, and you sit back against the chair too. And it just has a controlled lengthening. I feel the muscles stretching in my back and mid-back. Now this next one here is, a lot of times people have upper trap pain in your neck. And a lot of times there's been people have shown exercises rolling the shoulders back and forth. For this one here, what I'm trying to do, and you could have your arms to the side or on the rest, I'm just bringing my shoulders up and down to my ears is all that I'm doing. So for this one, I'm just trying to get some increased blood flow, trying to bring them up and back. I'm not bringing them forward or back, just up and down to my shoulders, up and down to increase circulation. Just relax those muscles for a little bit, because you're at the computer usually for a long time doing a work, especially with COVID and everyone at home doing work on their computers in addition. Now, this next one is a little bit more for muscle activation or posture. What you're really doing is simply just, if you have a little chair behind you and you can reach right behind you, all I'm doing here is just pressing with my elbows. When I press with my elbows, I actually lift my chest up in front because my shoulder blades pinch back a little bit in the back. So I'm really helping to activate those muscles. And you can hold for a count of 5 or a count of 10, and then make sure you relax for a count of 5 or a count of 10. Oh, looks like I fall asleep on the job. So again, you're just pressing back. It helps to lift your chest up, and you're helping to stabilize the muscles in the back of your upper back between your shoulder blades. Now the next one, I really do like this because I feel like it pulls everything in. It really lifts up your posture and your abdominal muscles and your back at the same time. Now for this one, I actually come a little bit away from the chair and I press my hands palm up. I'm close to the desk table and I press up. When I press up, it's pure physics. So I can't move the table. The table's sturdy. So when I press up, I actually pull in my abdominal and I pull in my back muscles because it's equal opposite force. You want to make sure that you get close to the table, that your elbows are back about 90 degrees, and all with these exercises, it's like 50% effort. I'm not giving 100% because I don't want to hold my breath. I want to make it easy where I'm giving just a 50% effort, holding and stabilizing and relaxing for the same amount of time that I'm pressing up. And this, like I said, is really great for that core and back stability. You feel that equal opposite pressure. And you see with just a little 50% effort, how it almost makes me look a little taller when I push up because I'm using my core and back to stabilize me. Now this one, you're sitting, you really need to get some length in those hamstrings and to not be just, not ignoring the rest of our lower body, looking at that in addition too. Now, the thing in particular I want to emphasize on this is that when you go to do this exercise, hip press down, what I'm really talking about is using sort of the back of your thigh to press down in the chair while you go to lift up your leg and as you're lifting, bring your toe up towards you. So I don't just lift my leg and hold it up. That would really feel more discomfort in the front of my hip. What I'm doing is I press my leg down into the chair at the same time while I'm bringing my leg up and bring my toe towards my head. So again, what I'm really doing is I press down with my leg into the chair as I bring it up to get that nice stretch coming up through the back of my leg into my calf. And the press down and lift up. And again, I'm sitting back in the chair supported. Now for this last exercise, I had to get everyone up and get out of the chair. We don't want to stay in the chair too long, do we? So this is actually my patient again. And you can see right here that I have her standing nice and tall. I had her just put her palms facing forward so she's nice and tall, upright with her chest. And I gave a little tiny squishy ball to put between her thighs at the very top here. Because all I'm going to have her do in this position, believe it or not, is she's just going to squeeze her buttocks and she just sort of comes forward. She's not coming up high on her toes at all. It's just a tiny, maybe 1 inch lift. That's all it is. Now, with the opposition of the ball, when she squeezes her buttocks, the ball opposition pulls in her core too. It's amazing how doing this little tiny exercise, you're able to work on all of this pelvic floor, pelvic muscles, the abdominal and the back. So it's helping your posture go all the way up. So it's all it is a small lift, squeezing her bottom, and you can hold for a couple seconds. You don't even have to lift on your heels if you don't want. You could just squeeze your bottom and shift your weight forward onto your toes. And you feel that stability in your spine going all the way up for your posture. Any questions, any comments, any recommendations from anyone?
Thank you, Melissa. If anyone has any questions, you can go ahead and put them in the chat box, or you can actually just go ahead and unmute yourself and ask if you would like. I know we've had some questions in regards to with kids sitting down. A lot of kids are still doing virtual school. Do you have any recommendations? I know some kids like to cross their legs or sit on like on their basically kind of like on their behind with their legs behind. Is there like a proper way for kids that you would recommend?
Yes, and the thing about kids too, the younger you are, usually the less attention span you have. Kids want to be active. They want to move around. Um, and they might fidget a lot, move back in the chair. There is actually, for the kids that want to move, it's really hard to sit and focus for that long time. There is something called a Swiss disc, and it's just something for them to sit on in the chair so they have stability, but for them to be able to maybe fidget and move a little bit. Because otherwise, like you said, they may be pulling their leg up, sitting like this, twisting and sitting like this. So just like the adult, you want to have them sitting down. You may have to take a book because you don't have a small chair and prop the book up so they have something to support their feet on. Or even I've had patients have an old trash can and they just pulled the trash can over to support their feet on top of. So with the kids, you do want to have them supported. You do want to have them at a table. Try to raise up the screen so it's at eye level. All of the same things for the adult, but for the kid as well. And like I said, the kids like to move, so trying to give them a little break if they can, throughout some of the classes might be helpful. Any other questions about physical therapy in particular, what we have to offer, or about any of the exercises, about posture or ergonomic fitting?
Do you have any recommendations on, I noticed you talked about like the wedge pillow and different things like that. There's so many things nowadays with people working at home with having pillows and different things. Do you have recommendations on anything that people should use to help them? Because I know a lot of people are sitting maybe on their dining room chair or, just anything. Is there something that you can recommend as far as for a pillow?
Yes, there are a couple things. As you saw, I don't know if you recall with that patient, um, in order to get her a little more upright, because the size of her body was, it was a very small wedge. And it was actually 6 inches by 2 inches in depth. And that sort of helped her sit back so she was at the right position. And I believe it's called a yoga wedge. It's 6 inches by 2. Sometimes I'll have patients get that. Sometimes I'll simply have a patient roll up a hand towel and use that to support even their low back or to support at their hips. Sometimes I've had them even take up a hand towel, put it through a stocking, and then tie the stocking around the chair so it doesn't slip up and down every time. Another thing that I had in the picture for the patient was a half foam roll. So the half foam roll is sort of like a semicircle, like a little moon. And she could stick it right there in between her shoulder blades. So she felt like she could sit back. The one that I used, I'll use that, but I also use this. This is actually TheraBand, and it's really a stability cushion. And the stability cushion has really large ones. This is a small, it's only 8 inches, again, by about 2.5. So only 8 inches in length. So this is a foam cushion. I'll sometimes put that right behind my back to give me stability, like the half foam roll. Another thing I'll use this for is somebody who's shorter and needs that foot support. I'll put this down. Maybe they only need, 2 inches or something to prop their legs up to help give them a little bit more bend in the knee and bend in the hip to make it comfortable. So it's all about, especially at home, looking at what you have, looking at this setup that I was trying to describe. So the wedge, the half foam roll, the TheraBand stability cushion, and even right now, believe it or not, I'm in the pediatric room closed in here, and there was a game for pediatrics that I had to actually prop the laptop on top of so I can reach it because it was too low for me. So you never know what you might have at home, you know, to use that you can use similar to the things I suggested besides purchasing something.
That's great. Right. One other question that I do see here too is, do you recommend any kind of, as people do sometimes have like these sore backs and different things to that nature, not able to really get out to the massage parlor as you used to. Do you have any recommendations on any sort of like ointments or anything to use for like lower back pain? It looks like they're asking.
As far as ointments to use to try to relieve, if you want something to rub in the clinic, we'll use Biofreeze gel. And it's almost like a Bengay, a tingling thing. It's a cooling gel. You can buy Biofreeze gel with a roll-on, so you can just roll it on. When I use the gel myself, just with my fingers, I have to put gloves on or my fingers will be tingling all day. So that's something I'll usually recommend. Sometimes you can get a full foam roll and you can just roll with your body on the roll, getting out of that position, or even just lying on your back with your knees bent and just doing a slow rocking back and forth. Sometimes will help calm down the spastic muscles. And ice. Usually I'll say using just ice for maybe 5 to 7 minutes, because ice is just a topical solution. It's going only a certain depth, and 5 to 7 minutes, usually you'll burn, ache, and get numb, and it's done its trick. You don't want to leave it on a long time, because blood flow is a good thing. You don't want to keep it on 30, 20 minutes, because that's not going to be helpful. It'll sort of defeat the purpose of the topical ice, just to give you that couple minutes of relief with some of the cooling or the numbness.
I see we have someone saying, I've used Biofreeze both gel and roll-on. The roll-on is great because it helps massage the sore spots as you're applying it, which is very true too. And I know that there's also patches as well. I've seen, I think like the Salon Paws may have patches. I personally have used those. So
Yeah.
That's all great. Great info here. Well, if we don't have any other questions, I do appreciate everyone taking the time out of their day to learn this valuable information. You can wear them up to 8 hours of relief. Wow. So that's a long time. And that's a good thing.
Yeah, that's a good thing.
We all need as much relief as we possibly can. So Melissa, I really want to thank you so much for taking time out of your day and showing us these great, it was really helpful to see the videos, I thought too, to really see how to do those stretches, because it's so important with us being, you know, some people are sitting on the couch, some people are sitting wherever. So it's important to know what it is, what the proper way is, so that we're not in this type of pain or anything like that.
Right.
And many people who are working from home, and we don't know, some of us don't know when we're going to go back to the office. So it's valuable and long lasting information, I would say.
And I just want to thank you all very much for taking the time to listen, and just remember to sit nice and tall so you can breathe better.
Sounds good. All right. Thanks, everyone. We hope you have a good rest of your day. and you sit up straight. Have a great day, everyone. Bye-bye.
Bye-bye.